Hello, my name is Dr. Jessica Eccles, and I am an Associate Professor, a reader in Brain Body Medicine at Brighton and Sussex Medical School.
My name is Lisa Quat, and I am a Senior Research Fellow in the Department of Clinical Neuroscience at the Brighton and Sussex Medical School.
We have previously shown that people who have hypermobility are 30% more likely to not recover from COVID. We showed that in a British sample that was predominantly white and female. So the purpose of this new study, published in BMJ Public Health, is to test that question again, but in a more representative population. So that is what we did. And not only did we look for the presence of joint hypermobility, we looked for some associated features like easy bruising, soft skin, being able to sit in the W position, and created a measure of extreme hypermobility.
So we found that people with joint hypermobility have a significantly higher risk of developing long COVID after they had a COVID-19 infection. So we surveyed over 1,800 adults from the UK and the US, and we found that those with generalized joint hypermobility had a 23% higher chance of developing long COVID, and those with extreme hypermobility had a 76% higher chance of developing long COVID. And this increased risk seems to be coming from two different possible factors. So for one, we found that people with joint hypermobility are more likely to experience severe initial COVID symptoms when they have their infection. And this in itself is a risk factor for long COVID. We also found that people with joint hypermobility have a higher chance of developing long COVID even after they had infections with no or mild symptoms.
This study is so important because it shows that the initial findings that being hypermobile is associated with being more likely to develop long COVID are true and were replicated. So that's really important for the science. But for clinical practice and for scientific understanding, it means that we should identify a subgroup of people with long COVID who have hypermobility, who may have other features. So they may have things to do with their autonomic nervous system, things like postural tachycardia syndrome. And it's really important that we recognize this so that we can target interventions to help people who have long COVID and hypermobility.
So for the future, this means that understanding these connective tissue traits gives clinicians a powerful new tool for identifying people who might be more vulnerable to long COVID, even if they only had mild or no initial symptoms when they had COVID-19. It will also allow us to think differently about prevention and diagnosis and care. And this potentially might lead to more personalized treatment strategies for the millions of people who are affected by long COVID.
So long COVID is one of the biggest health problems of our generation. This study is really advancing our knowledge to improve personalized treatments. Please read more on the link below on the BSMS website and read about our other studies too. Thank you.